All right. Good afternoon, everybody. Come on in and take your seats. We appreciate you. My name is Mac Boyder. I'm a research director with KLAS, and we are going to be talking today about physician burnout to business traction. How can we actually take what the Arch Collaborative has developed over the years, the information, the data, the details, put that together in a way that actually illuminates and highlights from a provider perspective and a vendor perspective the options around doing that and how we can actually focus in on one of the key areas, which are virtual scribes. Obviously, due to COVID-19, some of the areas around at-the-elbow scribes, things like that, there's been some transitions, so we're going to be discussing that. We have today with us Dale Keavy. Dale Keavy is Senior Director of Communications at AQuity Solutions. He authored the Physician Burnout to Business Traction white paper that actually is the basis for our conversation today. He sits on the For the Record magazine's editorial advisory board and earlier served on the Medical Transcription Industry Association Board of Directors. He contributed to multiple AHIMA clinical documentation standards as well as AHIMA Foundation research studies. We also have with us Christine Williams. Christine Williams is the Director of Health Information Management at University of Wisconsin Health. Christine is a nationally recognized clinical documentation expert directing a team of nearly 200 documentation specialists and revenue cycle professionals. She's a member of the National AHIMA Board of Directors and on behalf of UW Health orchestrates a wide range of labor and technology documentation solutions. Today she's going to share with us how scribes fit in that mix, how they can contribute to physician wellness, and how they impact clinical and financial results. And we also have with us as well Jamie Christian, apologize. She's the Director of Virtual Scribing Solutions at AQuity. She also does by the way, I just have to say, Jamie is one of my absolute favorite people. She is someone who is very well spoken, but she's a pioneer in the area of scribing, which actually since 2010, she right in the infancy of scribing and how that kind of came about. She currently works at AQuity Solutions, having worked in other areas as an interim scribe, as a trainer, recruiter, etc. She launched with AQuity Solutions in 2017, now directs operations for large enterprise scale accounts. In her role, she coordinates new client go lives from discovery through program scaling and ongoing relationship management. So with that, we're excited to kind of dive in today, and we encourage your questions. We're going to turn over to Dale, who's going to take us off with some information.
Wonderful. Thank you very much, Boyd. Today's presentation, again, is kind of launched from an article that was published in the Journal of AHIMA in November on physician burnout to business traction. And that topic really focuses on what is the cause of physician burnout, and we'll get into some of those details here and then talk about what's practically been achieved through the application of virtual scribes. That article, which I encourage you to go and take a look at, is basically a collection of white paper studies threaded together for this effort that were initiated essentially through the 21st Century Cures Act, Section 4001, which specifically talks about the reduction of the administrative burdens because of its impact on patient care. One of the big drivers that came out of that was the AMA Practice Transformation Initiative studies, and there's a variety of those studies that are referred to in that particular white paper. In addition to, of course, we got to give credit where credit is due to the Arch Collaborative. Specifically, Dr. Thomas Mason, the Chief Medical Officer for the ONC, referred to the Arch Collaborative and the efforts done to move forward in EHR satisfaction and focusing on what can be done to relieve that administrative burden. And all of that is included in that article and will be addressed here with what we talk about today. I'm not going to read these statistics for you, but you can take a look at them behind and over my shoulder. Physician burnout is obviously a very significant problem. Because this was a white paper that got published last November, that meant that the article was actually completed in the spring of last year before COVID hit. If you look at those statistics, you think, geez, these are really notable. Obviously, through COVID, they've gotten significantly worse. And so it's time to do something about it. Instead of just focusing on what the problem is, let's focus on what the solution might be. One other slide before I'll turn it over to Christine, because obviously she's much more interesting to listen to than I am. The AMA Practice Transformation Initiative did a survey of more than 15,000 physicians, 29 specialties, and they looked at the top 10 causes of burnout. the top 4 of which all can be tied back to the administrative burden specifically inherent to an EHR. The KLAS Arch Collaborative obviously is looking at EHR satisfaction as their ultimate goal. I would like to extend that a little bit, and let's talk about physician satisfaction. Guess what? If the physician is happy, they're going to be more happy with the EHR if you take care of some of those problems that are inherent to the EHR for them to be effectively interacting with their patients. And with that, we'll turn it over to Christine.
As mentioned, I'm Christine Williams. I'm here with UW Health. I am the HIM director, and I think it's really critical to be able to share why I believe this partnership with the Health Information Management Department is so critical. I'm going to give you a little bit about that background before our scope here. We work very closely with our physicians, but typically to say, this is what you're missing, this is what you did wrong, here's how you need to build this differently, and oh, by the way, can you go back and look at your documentation? So when we were really taking a look at this opportunity to partner with Virtual Scribes, we thought about including this as another enterprise solution. So we do have transcription, we have a voice to text, we have partial dictation, and we had on-site scribes. And so in looking at this opportunity, we wanted to make sure we weren't just adding something additional. The partnership with HIM worked very well because instead of asking for things on the back end, we were able to partner with our AQuity partners to say, here are some things that would be helpful. So we're not asking for all these additional documentation requests and things of that nature. And so for us, we have found this to be very successful. And we started with the scope of 100 providers. That was to be phased out in the course of 1 year. We decided to go with primary and specialty to keep the scope small. And we did ask and request that our providers add 1 session to be able to offset the costs of the program. Things that we kept out of scope were inpatient, emergency department, urgent care, and our mid-levels. I have talked to other colleagues across the states, and they have incorporated these and been very successful. But for the scope of our project, we did limit it to just primary and specialty care. So I wanted to share with you some satisfaction survey results from the physicians specifically. I love the Arch Collaborative data. I think it's excellent, but we wanted to know how is this really impacting our physicians. So we catered some questions to them specifically, and I want to go through those. You can see that overall the satisfaction for our scribes are in the upper 80s to 90%. What's interesting is from our February to October numbers, the big thing that happened obviously is COVID. So we had to make very quick pivots from seeing patients on site to then having them virtual, and the Scribe program didn't miss a beat for us. So while it was really critical, and we have seen a lot better adoption and usage of the EHR, we are also seeing far better documentation. I love number 5 here. I think it's just a true testament to be able to relieve some of that burden and expectations, and that it's that the Scribe helps them reduce their after work hours. And that was something very measurable for us, is what we call the Pajama Time. We were able to see the Pajama Time reduction, and that's been something that's been such a huge satisfier. And you're able to see those up here on the screen. And I'm sure if you've talked to colleagues or others in the industry, you may have heard the same types of things, that it makes my interactions with patients more enjoyable, better flow, patients wait less, better face-to-face experience, improves my the overall work. Something that was really critical as we looked past our first phase was that we weren't placing that expectation for 1 more session because it was really about satisfaction, wellness, and understanding that physicians have many different expectations from patients, expectations from the organization and leaders, as well as HIM departments, IT. And so we didn't want to add 1 more expectation of adding patients. So we have removed that since we have started the scope of this project. These statistics, I think, are rather interesting because I believe we've been very successful because we have a scribe from AQuity that is matched specifically with our UW Health provider. This shows here that on average, you'll see they have 1 to 2 scribes in a month. One of the reasons I think that's important is because you're not getting different scribes or a different scribe pops on every time. It's really about a relationship and a partnership. And that's what we have found to be most successful. You can see here that the percentage for the primary scribe is typically up in the upper 90 percentile, which means when that scribe happens to have a day off, that there's a backup scribe that's able to support them. So for us, it's been very successful. This is a true testament of that reduction of pajama time. You can see here that in the upper 80s, 90% of the time that the scribe is completing the encounter. So there's very little that our providers are doing outside of the patient visit. This also includes assistance with their in-basket, prepping charts for the next day. So all that kind of the pre-charting in-basket, that's all done for our physicians. And so that's been a huge satisfier for us. This is one of my favorite scribes my favorite slides, because what we've been able to identify is improvements in reduction in times in the notes, increased % of orders with team contribution, reduction in time and system spent per day, that reduces time on unscheduled days like weekends and nights. And there hasn't been a change in time outside of that 7 a.m. to 7 p.m. So as I mentioned, we had a lot of shifting like everyone with COVID last year. And this was very helpful and successful for our providers. Some of the Arch Collaborative data that I think is interesting, you can see here just from our Scribe Satisfaction percentages. I'm not going to go through all of these, the slides will be available, but you can see across the board, response times improved, the ease of learning enables efficiencies. So while the provider is teaching the scribe at times what their personal flow is, the scribe is actually acclimated to EHRs. They're trained very well by our AQuity partners. And so at times they're helping our providers navigate the EHR as well. And then this one, the true testament to why we developed this program at UW Health, and we've expanded it outside of the 100. We have now almost, it'll be 300 in the next 2 years that we'll have fully rolled out. But this was really the mission behind implementing virtual scribes at UW Health. And that was to reduce burnout, hours charting at home, things of that nature. And as we heard this morning, don't stop what you're doing, keep doing it. These numbers are continuing to improve as we're checking in with our physicians, and truly the reason that we move forward with it. So I'm going to turn it over to Jamie with AQuity, and she'll talk a little bit more about the program.
Thank you.
Yeah.
Hi, I'm Jamie with AQuity Solutions. I'm going to talk about why do virtual scribing. So our goal is always physician wellness, just reducing that burnout, making the virtual staff the new normal, especially in this new age and wave. There's all these people in the room and lots of different tasks to do. And so being able to virtualize the staff maximizes the capacity, improving for both provider and patient experience. So having a virtual scribe in the room allows the physician to focus on the patient, not focus on the computer, make that eye contact. And with the virtual scribe, you have a little bit more intimacy with the patient. With the live scribe, and as Max said, I was a live scribe, I'd be in the room typing, listening in, and it's just not as intimate, right? So now with with the virtual scribe, you have that really good connection with your patient and increase revenue. So organically with the virtual scribe program, you just see better documentation, quicker revenue cycle turnover of notes, and just overall better documentation. So what we like to do with our virtual scribe partners is track all of this. So we partner with you, look at different metrics that we can actually measure to see where we need to improve. Every physician's different, every office is different. So do we need to increase your patients per day, patients per week? Do we need to decrease your pajama time? Do we want to improve your documentation because you use templates or the copy forward button? All of those different things are things that we can measure and improve with the virtual scribe. Every virtual scribe, you can improve the RVUs, improve the number of patients seen per day. I find really interesting is the increased clinical review time. So physicians are actually reading their charts more thoroughly, less risk, more thoroughness. It's amazing. And in closing counters the same day. That same day with the scribe, you can close all of your patient notes, no problem. Reduction, as Christine said, after hour times, the time they spend in those note and order modules, I would say those are the most complicated part of any EHR, all the little clicks that you have to put to enter in an order. Days to close encounters, manually written notes, all of that goes down. So virtual scribe options. So we offer the real-time option. I describe it as having a scribe in your pocket. You walk around with your phone or laptop and your scribe's just with you the whole day. Real-time, entering orders, assisting with the in-basket. I would say the biggest time saver is pre-charting. So a lot of physicians, every single physician, no matter what specialty, they read the note from the previous visit, look up the labs, look up the orders. That takes time out of every physician's day. A scribe can go in the night before as a virtual scribe, do that documentation prep, and then give that report to the physician, and just automatically increasing their day and their efficiency. The other two options are asynchronous or non-real-time options, and this allows customization and flexibility. Not every physician wants to use a real-time scribe, I would say small percentage, but often they're like, I know how I document, I know my templates, I know exactly what I want in the note. And so we have these non-real-time versions that are good options. So our goal is to, is there a video that I need to click here?
No, but
Oh, okay.
when you get to that slide, that's my cue.
Oh, okay, I'm sorry.
Obviously, we really look forward to the interaction back and forth. We'll be launching a video series next week under Creating Physician Satisfaction, the Value of Virtual Scribes. And it is the actual experiences from some physicians with Central Ohio Primary Care when they went through their pilot program. And we think it's really important. Obviously, I write articles and I help do the marketing for AQuity. Jamie is on the front row. Physicians are the ones that you really want to be talking to. Christine can tell you so much about how to manage something in the background as scribes, as one of the components, one of the arrows in the quiver for your documentation opportunities. But when it comes down to physician satisfaction, it probably wouldn't hurt to talk to some physicians and find out how they really feel. I think you'll get a lot of benefit out of that. That'll be available through AQuity next week. But other than that, thank you for your time and attention, and we really look forward to the interaction, any questions that might come up. So with that, any questions? Mike is on the way.
Coming.
Ladies first.
I was writing notes. You said there's 3 types of scribes. There was the real-time, the scribe assist, and a third one.
Correct.
Can you just
Sure.
explain again how each of the I
Yeah.
think the real-time is kind of obvious. And does the patient know there's someone in your pocket?
Absolutely. So
I'll take that one.
Yeah.
So that was
100%.
one that, working in the area that I do, I felt very uncomfortable. So we had to have, very strong processes of this is how we notify the patient. So the patient's notified before they come. So they receive a piece of paper when they're on site that lets them know what's going to happen and that they have the right to not consent to it. We have 98 or 99%.
99%.
Yeah, say yes. A lot of times they're introduced to the scribe and they're like, oh, hi. And some providers like interaction and others say, I don't want you to speak. It's really provider preference.
Yeah.
But it just depends.
In the interest of time, the 2 other options, one of which includes a recording of the actual encounter between the patient and the provider. That's Scribe Assist.
And
then it
Scribe.
gets delivered the next day. Okay. And the physician can add additional notes to it after the encounter recording. Okay. Some physicians, that's just the way that they prefer to do it. The third, DynaScribe, is just physician notes after the fact. If you're doing physical therapy or something like that, recording the conversation for someone who might be there for 30 minutes really is not going to add the value that you might want to get out of that. So that's the other option that's available there.
It's more like directions. It's like a direction focus. So use my normal smart phrase here, pull in the old last note from March 16th, delete the first paragraph, write this. Those recordings are really short, whereas the Scribe Assist records the whole visit. So a 30-minute recording or a 10-minute recording. We had another question here.
Sure.
For onboarding of a virtual scribe in the synchronous option, what's your typical time frame, for them to learn the physician templates and patterns
Great
and all that?
question. So that varies, I would say. Christine can talk about this. I think the more you have, the more you work with your scribe, the faster the onboarding. So a family medicine doctor working every single day with their scribe, they'll start seeing the impacts weeks in, right? A physician that may have a more limited schedule, so they're, 2 days a week in clinic, half days a week, they may see a little bit longer to take with the onboarding, and that's just building that relationship and rapport. I also think the evolution of the scribe evolves. So the first month you use your scribe, you're still learning. What are your best practices? How you want to incorporate it into your clinic? 6 months in, you have that trust, you know your scribe, and so you ask them to do more. And so it evolves with time.
And UW Health and Christine has developed a wonderful program of prepping the physicians for
There's
this.
a lot of prep.
This is people. It is not a plug-in and now you've got new software and it's live and fully up to speed immediately. So
Yeah. Please.
And then we have a virtual question.
I remember back in the early days of the scribes, I think 06, 07, around that time when scribes were really hot and all that. There was always a number that said for every 2 patients you see, you could pay for your scribe. Is there a number now? I just hadn't checked in a while.
one of the stats that's on one of the slides here is that on average, it's more than a 10% increase in RVUs. Okay. So that has an impact on it depending on how you want to do your math.
I can share at UW, it was for a 4-hour session, you had to add 1 patient to cover it.
And obviously that can vary a lot.
And that
by
was for
specialty.
primary and specialty.
Yep. And
That's an
a
excellent
question from the peanut gallery.
Yes.
Sorry.
Okay, so this is coming from our virtual attendees. They want to know, what is the actual tech setup? Is there a microphone anchored in the room, a scribe on an iPad? What is the actual tech setup?
You want to talk about UW?
There's a number
Yeah.
of options to that.
Yeah, so I will say that it can be very specific to the organization. So for UW, we started with iPhones. We made the transition from iPhone to iPod because they were less expensive and we had more providers wanting to use the program. So we've made the switch from iPhone to iPod, but I know there are other options.
It's any technology device, so laptops, desktops, tablets. I love the iPod and the iPhone option too.
They're small, they go in the pocket.
They're small and they go in
easy
the
to move in.
pocket. Yes. So the desktop option, a lot of workrooms have desktops in them, but signing in and out of a computer, I don't think is innate to a physician's workflow. And so just being able to go in the room, start talking to the patient and not having to log in and out, I call it like the one connect method. So however you connect at the beginning of your day to the scribe and then remaining connected is the best workflow for physicians. However, multiple options. So
One of the other options is a jobber device. If you think of it kind of like an Alexa that might sit in the exam room and they can listen to and hear everything back and forth. Before you get started, I believe there's another virtual question. And then we'll go to you next. Oops, sorry.
Are those technologies owned by the physicians or owned by the organization most often?
So at UW, they're owned by the organization. They come through our IT department. It's just for us to be able to keep track where it's going and ensure that it's enabled. The iPod was the most financially, responsible. It was less than $200 for us to be able to provide these iPods out to the providers, but they are owned by the organization. We have had some providers ask to use their own. And while there is no issue from a technology perspective, UW just chose to have that maintained within the organization.
AQuity is a SOC 2 certified ISO 2007 or 27001. All the security in the background to make certain that everything is HIPAA compliant and managed appropriately. Sorry, ma'am.
So if you're using iPods, that's not a video interface. It's
No
just
video.
an audio. So you never see the
no,
scribe.
it's all audio.
Right.
Okay. So my other question is, what's your turnover in scribes? That's usually somebody who takes a temporary job before they go to medical school or something like that. So
Well said.
you train somebody over several months and then they leave. What's your turnover rate?
So I can share the experience at UW because that was a concern of mine as well. And I know when we were first looking at virtual scribes, I will share that as the HIM director, I was like, we don't need one more thing, I have something that we're going to roll out. And I did quite a bit of research because that was a concern of mine as well. Their turnover for AQuity, and they can talk about the numbers specifically, is far lower than across the industry. And that was important to us. We don't want to continue to add burden by having the turnover. And so some of the turnover that we've seen has actually been more on the UW side because of the provider, wanting a different preference or switching the schedule. So if a provider switches the schedule and it doesn't match the scribe, then the scribe will turn over and we'll have someone else.
Yep.
Or as mentioned, one more thing.
I'm sorry, we've got limited
Yep.
time. We just had someone say.
One
minute.
second. or because of exactly what you said, and that's that turnover because it's the pre-med, but that's also what's made it such great synergy is because they understand medicine.
Yeah, there's a lot of pre-med students that go into this, so inherently they're done in a year or so. Our percentage of virtual gap year med students is lower than the industry average, as well as we have options where we have offshore scribes, which are permanent employees, and obviously with us, mostly credentialed MDs or nurses, and they'll be with someone for however long they'd like to be there. So
Our
there's
domestic
different options.
resource average is about 18 months. The industry average is about 9. So we're double the industry. We still see that turnover, but because we hire multiple cohorts of individuals domestically that are looking for careers and we provide them the virtual option, they stay longer.
And we've
In
only
global, we talk about their longevity in years because that's their career scribes. And so if turnover is an issue that you are trying to avoid, global is a great option. I have one of my clients, 200 global provider user, and they've been using their scribes for years now, same partnership.
And one more
Most of
thing,
them.
I think this is really critical. We haven't seen a lot of that gap because there's always a backup. So if the scribe is out ill or a vacation, there's a second person that's familiar with that specialty or provider, and then they move right into it, which was different why we went with AQuity is because there is that backup and you're not starting from ground
You
zero.
can get that with virtual. That person that fills in when someone's away is trained by the primary so that they never have to worry about gaps in coverage, which is a chronic issue with at the elbow scribes. When someone leaves, you got to wait before you find someone else to be there, and a totally different business model.
I would just say KLAS has also spoken with providers on AQuity solution beyond UW, which is phenomenal. And that is something that definitely came up as a concern at the same time that the protocols that they were discussing here really, that we were able to validate. Those are the efficacy of those. We have a question here, and I think we have another quick question.
Yeah.
We have time up. Oh, shoot. Okay.
Well,
Okay.
I'm happy to take
You can
questions
send
and find us.
questions, yeah.
Yeah.
We'll
Yes.
answer them.
Yeah. Our contact information is, available, and we're happy to interact with everyone. We all came with pockets full of business cards and look forward to engaging with you all. That's me being the marketing guy.
Thank you, everybody.
Thank
Thank you.
For those of you that are online, you can go in and go back to your agenda, and we'll have other sessions to come.